By virtue of their training, doctors want to help a patient who is suffering. Until recently, however, most available options in the treatment of serious back pain have been limited and failed at treating the underlying causes associated with disc and joint problems. It can be frustrating to doctors when they cannot relieve a patient's pain. Too often, back surgery is considered as the next step, simply because a doctor thinks it is the only alternative. CBS News reported that in the United States alone, there are 80,000 unnecessary back surgeries done each year. But surgery has its own drawbacks.
Back surgery should not be entered into lightly. Besides hospitalization and the recovery time that you must go through, you also have the risk of general anesthesia. In addition, problems can arise from infection, scarring, and its associated complications. The surgery may also produce a general loss of mobility. An even larger consideration is that many times the surgery just doesn't work, or if it does work, it often only offers temporary relief. You see, when you surgically change one disc, you can actually put additional pressure on the disc above and below it, which can lead to future back problems, sometimes even another surgery.
VAX-D therapy offers new hope for people with serious low back problems and offers doctors and their patients a non-invasive procedure designed to reduce pressure on the affected discs and joints, allowing them to heal naturally. VAX-D does all of this without any of the risks or the high costs associated with surgery. In fact, VAX-D is less than 1/10 the cost of surgery.
In 1995, I was involved in an automobile accident. I went from being a happy, healthy woman into a miserable, irritable person who was in pain every day. Every morning I would wake up and I would have pains shooting down both of my legs, constantly, all day long. They would last. I had severe pains in my lower back. I was experiencing spasms in my lower back area. My doctor decided to put me on some conservative care. We tried that for a while. We did a lot of physical therapy, massages, ultrasounds. I've even tried medication, and nothing seemed to relieve the pain I was experiencing. Finally, I even decided to have surgery. The surgery that I did have did relieve some of the pains I was experiencing in my legs, but it did nothing for my lower back area. Finally, my doctor found a therapy called the VAX-D. I decided to go ahead and try the VAX-D, because at this point in my life, I was going to try anything. I just wanted to wake up one day and not be in pain. I went ahead and tried the VAX-D. I did 15 consecutive treatments on the VAX-D, and one morning I woke up and I was able to sit up in bed. I was never able to sit up before. I used to get up in the morning and roll out of the bed, get on all fours and pull myself up. And that morning when I woke up and sat up, it was one of the happiest days of my life.
VAX-D has been the subject of several clinical studies and has been written up in the Journal of Neurosurgery. Most recently, an independent study of more than 900 patients treated with VAX-D therapy was published by the Medical Technologies Group. Overall, VAX-D was shown to be successful in nearly 8 out of every 10 cases, including patients suffering from single and multiple herniations, degenerative disc disease, and Facet syndrome. Due to this remarkable success rate, VAX-D has had its share of media attention in the United States and in Canada. VAX-D therapy requires no hospitalization or anesthesia. This simple procedure consists of a series of 15 to 20 treatments scheduled at your convenience. You begin each 30-minute treatment by lying comfortably on the patented VAX-D table with your lower back fitted with an adjustable nylon harness. Simple hand grips connect the upper body to the table and allow you the immediate freedom to release and end the therapy session at any time. The table slowly divides under computer-controlled and monitored conditions, gradually relieving pressure and decompressing the affected discs and joints.
VAX-D literally takes the pressure off your discs and spinal nerves. As you lie on the table, the pressure within the disc in your back is measured at 75 millimeters of mercury positive. The VAX-D therapy reduces intradiscal pressure to as low as 150 to 200 millimeters of mercury negative, which creates a vacuum within the disc. Now, simply put, this reduction in pressure allows the back to help heal itself in two major ways. First, it creates a vacuum-like state in the disc that helps retract the nucleus. This retraction, in turn, helps to allow the outer layers of the disc to get back into position and begin to mend. Just like a broken bone has the ability to mend itself, the outer layers of the disc can mend themselves once the pressure is taken off the disc and nerves. This is an MRI of a patient with a ruptured disc. The spinal cord and nerves show up as the white column. You can see the rupture, which shows up as the dark circle, putting pressure on the nerve. After treatment with VAX-D therapy, we have a follow-up MRI that was taken in the same area. Now, as you can see, the ruptured disc has retracted and the pressure on the nerves has been removed. Prior to VAX-D therapy, this just wasn't possible.
If you suffer from low back pain caused by a herniated or degenerative disc, there is new hope. With VAX-D therapy, there is no hospitalization, no surgery, no fear, and simply no reason to suffer anymore.
Thank you again for your interest in the VAX-D therapy. We hope you call today and make an appointment with one of our network physicians. You'll be glad you did.